Students, this is Dr. Badrinath, and today one sad story which was happened in the Africa. See, this boy was suffering with the fever. So mother, what she did is she want to check out the temperature with the help of a thermometer. Unfortunately, what happened? This boy has crushed that thermometer and swallowed. Accidentally, the entire mercury was entered inside the body. Unfortunately, mother don't know that mercury will cause as a poison. See the situation. What she thought is it is some just like a liquid, small liquid like that. She thought mercury. Mercury is a poison. She don't know that. Okay, right. Now let's see the things, how the brain is become enlarged, very poisonous, mercury poison. If you Google it, the story will become in the Google. See, in the mercury, there is a wonderful antidote from the house. Immediately you have to give the milk. See here, that's why I kept the milk and protein food. Albumin is very good protein. Eggs you have to give. So what these eggs, milk, protein food, what it does, it prevents the absorption of the mercury from the intestine into the blood circulation. That is the main thing. It prevents the absorption. It is nothing but a household antidote for the mercury. See, information is wealth. Information is health. See the situation. That's why you have to know the things. See, today we will see all these topics. Barbiturate poisoning, barbiturates. Barbiturates means sedatives and hypnotic, not the bar and restaurant. Okay, barbiturates, not the bar and restaurant. Morphine poisoning, organophosphorus poisoning, lead poisoning, lead, all these causes a poison, mercury poisoning, arsenic poisoning. Okay, all these are the heavy metals, lead, mercury, arsenic. All the examination they may give you as heavy metals poisoning, lead, mercury, arsenic. Keep in your mind all these poisons. We will see how to combat it. See, all my notes, entire notes, all my presentations are available in the form of PDF in the Google Play Store. You can be download it, and all years, B.Pharmacy, M.Pharmacy, Pharm.D, first year to final year, all everything will be uploaded. Keep on upload. I will keep on uploading. Okay, don't worry about that. Explanation videos available in the YouTube channel. So after downloading the app, you go to the store option. Here I have shown you store option, and you can select the course. So if you open the course, automatically all the subjects will be displayed right from first year to final year. This is my mobile app. Go to the playlist option. Here I arranged all videos subject wise. If you click on each subject, you will get again topic wise. Everything all sweet and sharp, not the kilometers. Kilometers together means it is not possible. Okay, right. See, clinical, this is syllabus. Clinical symptoms. See, only two things. Clinical symptoms and management of barbiturates, morphine, organophosphorus, lead, mercury, and arsenic. Total six concepts. Each concept, two things you have to read: clinical symptoms as well as the management. How to manage. That's it. Sweet and sharp, everything. First one is barbiturates. Barbiturates, all pharmacy students, I know they are very intelligent. They know barbiturates are the group of sedatives and hypnotic drugs. These used to treat the seizures, insomnia, sleeplessness, anesthesia. Okay, and also used to increase the intracranial pressure in the coma. Okay, and overdoses leads to poisoning. Or sometimes what happens, not only overdosing. Those who want to suicide, they will open the barbiturates and they will take up 100 tablets, 200 tablets like that. So barbiturate poisoning, what is the clinical symptoms? We will see only clinical symptoms, treatment. Clinical symptoms, treatment. Pupil dilation. See here how much big pupil is there. Pupil dilation. That's why they will check in poisoning cases. Pupil very important. Loss of eye reflex. Even though you will put your pen here, they will not reflex. Slurred speech, saliva will be increased. Ataxia, crosswalking, because they do not have balance, lack of nystagmus, rapid eye movement here, head, not head movement, only eye movement. Head will be like this, and only hypothermia, less thermia, heat, less body heat, lethargy, type of dizziness, respiratory arrest, So automatically all these are interrelated. Like that you can remember. Slow, so less respiration is less, heart rate is less, like that. Hypotension, BP is less. So weak and rapid, since the pulse rate is less, decreased output, urine output, because heart is not pumping properly. Coma finally leads to death. Now, poisoning, what is the management? How to manage the emergency and the supportive measures? Protect the airway. ABCD I have told you in my last video. Say airway you have to be protect, and ventilation, you arrange the ventilation for breathing. Treat the coma with suitable treatment. Hypothermia, you have to heat the body heat less, so you have to increase the heat. And gastric wash, very important. Gastric wash with ipecac syrup, ipecac gastric lavage, gas stomach. This I have discussed in my old video, previous video. Activated charcoal you have to give. Repeated dose of activated charcoal and make the emesis. Antidote is naloxone, very important bit. Naloxone can be given. This medication rapidly restores the consciousness. Naloxone, rapidly consciousness you will give. Otherwise, they will no eye reflex. I told no, they will fall down unconsciousness. Elimination of the toxins from the body by changing the urine pH. See, alkalization of the urine increases the phenobarbital pumping outside. Phenobarbital, because this is barbiturate poisoning, but not other barbiturates. Very important. Hemodialysis, to eliminate hemodialysis, blood dialysis, to increase the output of the toxins. And next is morphine poisoning. Morphine, we know that is a fruit. Okay, and morphine, this injection is also available. Morphine is a very it is a wonderful painkiller actually. It found naturally in the dark brown resinous form from the poppy plant. See, clinical symptoms, management, treatment, antidote, everything is as that of the barbiturate poisoning. Both are safe. Barbiturate poisoning, morphine poisoning, both are safe. Only change is gastric lavage. You can be done with the potassium permanganate instead of the activated charcoal. And another one is a biggest problem in India is organophosphorus poisoning. It commonly happened in the farmers, because organophosphorus commonly known as pesticide. You can say pesticide. All pesticides consist of, because the farmers they are exposing daily to it, leads to poisonous. Organophosphate widely used as a pesticide. It kills the acid whenever the consumed suddenly or daily exposure. It leads to acetylcholinesterase enzyme inhibitor. So what happened? This leads to overstock of the acetylcholine in the body. So body is completely shifted into the parasympathetic system. Excess saliva, extra gastric juices. Okay, and this acetylcholine acts on the M and N receptors, that you know, muscarinic receptors. So nicotinic receptors. Muscarinic receptors toxicity leads to sludge. Sludge, SLUDGE. Sludge. This is a trick. Salivation. See, salivation. Lacrimation. Lacrimation. Urination. See, urination. Defecation. Motion. And ramps here. Cramps. GAT. Gastrointestinal tract cramp. Emesis. And symptoms related to nicotinic overaction. See here. Pupil mydriasis. Tachycardia, tachycardia increases, muscle weakness, heart rate increases. Bradycardia means slow, broadly. Tachycardia means tachy. Muscle twitching, fast fasciculated, high BP, paralysis will be happen. And this is the thing. General measures, ABC is common for everyone. Airway, breathing, circulation. Remove the patient from side. And see here, what you are giving is atropine. First, you have to give atropine initial dose, only small quantity you have to give. And if you are giving atropine excess, it leads to atropinization. So you have to check it. So you give the atropine injection, this only, not the more. Only this dose you give it. Check it for atropine toxicity. If atropine toxicity is not there, you can give again one dose. Again, like that. If atropinization is there, then maintain the dose. Like that. Repeatedly, you have to give atropine. You have to check atropinization. Atropine is very, very important. Lead poisoning. It leads to Burton lines here. Burton's lines or lead lines on the teeth. Very important. Burton's lines, bones and the teeth. Okay, and the reproductive system sperm count will be drastically decreased. Okay, in the female also it happened in male, and in the female also in the reproductive system disturbances, stillbirths. Okay, and disturbances. And lead poisoning is also leads to neurological symptoms. See, neuron systems will be damaged. Myelin sheet, you know very well, myelin sheet will become absent. This is called a demyelination. Very, very important in the case of lead poisoning, demyelination. See, myelin sheet will be absent. It may leads to wrist drop like this, wrist drop, foot drop like this. Okay, and hematological symptoms like a small blood vessel size will be decreased. Microcytic, hypochromic. Hypo means less, chromic means color. Less color, less size blood vessels will be developed. Gastrointestinal system, nausea, vomiting, anorexia. Renal system, pupils will be damaged. Lead is very dangerous. Chelation therapy. Is a chelation therapy. You have to give a penicillamine and a ball. This is called as a succimer. Succimer is a initial dose. Penicillamine. These are very, very two important things you have to write in the examination. This is mercury poisoning. This leads to here nervous system damage, motor system damage, immune system damage, renal system damage, reproductive system. All these systems you have to be note down. Okay, and so what you have to give? Gastric wash. Albumin containing foods like eggs, skimmed milks, gluten, myrrh. Antidote is dimer. See here, mercury poisoning, dimercaprol. Succimer, mercury. See here, like that you can remember. And unichiol. Okay, succimer, dimercaprol. Okay, sodium formaldehyde. You have some as a chemical antidote. Sometimes you give a sodium bicarbonate is also used. Arsenic poisoning. Arsenic is a chemical we are doing in the first year in organic chemistry. We are limiters. We are doing arsenic limiters by using separate apparatus. So garlic breathe. You will breathe garlic. If you are suffering with the arsenic poisoning, you will feel some garlic smell. If you see surroundingly, there was no garlic. But however, you are breathing like a smell also. Your breathe also garlic one. Okay. Nausea, vomiting, nerve damage. See, CNS necrosis. Skin damage like measlines. See here, measlines I have mentioned. Measlines too. Hypokeratosis, pigmentation, hypo, over neck, pigmentation of the neck. Your skin will be like a fish skin. Okay, and increased cancer risks like lung cancer, bladder cancer, kidney, liver, necrosis of GIT epithelium, urinary output, blood urea will come, blood urine will come, tremors will come, like here, convulsions. So this is a poison, penicillamine and dimercaprol. Gastric wash you have to deal with the ghee. It is a very demulcent, very smooth for GIT coating. Ghee, barley water is also good. See, demulcent means very smooth. Your inner layer will be ghee is excellent for most of the students. They are not taking because they will become fat. No, students has to take the ghee. Avoid the cool drinks. Okay. That is dangerous. Not the ghee is not the dangerous. Okay. Purgatives like a castor oil you have to give to wash out the thing. Arsenic poisoning. Antidote is ball. Dimercaprol is nothing but a ball. British anti-lavage. Okay. Vitamin E and selenium. Penicillamine. Okay. So I will end my session here. This topic is important in examination.